Welcome to the RSNA Radiographics podcast. My name is Dyan Flores, Assistant Professor of Radiology at the University of Ottawa and musculoskeletal radiologist at the Ottawa Hospital in Ottawa, Ontario, Canada. I'm passionate about writing and education, and of course, musculoskeletal imaging. One of the topics in musculoskeletal radiology that interests me is muscle pathology, specifically injury and return to play. Muscle healing, particularly the use of MRI to determine return to play and predict risk of re injury, is a hot topic in sports medicine with potential implications in competitive sports and a very timely topic considering the recently concluded Paris Olympics. Today, I am honored to speak with Dr. Jaime Isern-Kebschull from the Department of Radiology, Hospital Clinic University of Barcelona, in Barcelona, Spain, one of the authors of the article entitled Muscle Healing in Sports Injuries, MRI Findings and Proposed Classification Based on a Single Institutional Experience and Clinical Observation, published in Radiographics last July 25, 2024. Good day, Dr. Isern-Kebschull. Thank you so much for being generous with your time and speaking with me today.
Hello, Dr. Flores. Thank you so much for the invitation and for giving us the opportunity to share our work through this platform.
So, first of all, what was the inspiration for this radiographics article?
Well, this work emerged from our day to day clinical experience. For over 6 years now, Dr. Sandra Mecho, another radiologist, and I have had the privilege of participating in the evaluation of MRI studies for injured players from Football Club Barcelona. Muscle injuries are quite common and they often pose challenges in clinical management with a significant risk of re-injury. As a part of our daily routine, whenever a sports doctor or a physiotherapist had concerns about the progression of a player's muscle injury, we began performing MRI scans to monitor the healing process, even though there was very little published on the subject at that time. Over the years, we observed certain radiological signs that gradually diminished, while scar tissue formed and changed in appearance over time. When we connected these findings with the theory of Tero Järvinen, which described the milestones of healing from a histological perspective, we realized that everything aligned perfectly. This led us to organize the process of evaluating healing through MRI more systematically. Eventually, we thought that sharing this approach could be beneficial, helping other radiologists contribute to assessing the progression of muscle injury recovery.
Interesting. So, can you provide us with an overview of the article as well as the findings?
Sure, this paper sums up the findings from 310 MRI scans. We performed 128 injured players who had long periods of absence over 6 seasons, from 2017 to 2023. These players typically underwent MRI evaluations every 15 days, depending on their progress in rehabilitation, and always in the final week before they were cleared prior the return to play. We developed an MRI protocol that's shorter and better tolerated by the patients. By having three radiologists review the images, we were able to track the signal and the morphological changes in the tissue over time. In general, we identified three main phases in chronological order, aligning with what Jarvinan describes. The first one, the destructive phase, this phase occurs within the first 7 days post injury and is characterized by myoconnective tissue discontinuities and feather like edema in the adjacent muscle fiber. The second, the reparative phase, this phase typically begins around the 8th day when scar tissue starts filling in the gaps. We subdivide this phase into 2A and 2B to distinguish between early and late immature scars based on fluid-sensitive sequences. The main findings include the formation of immature scar tissue from the periphery to the center, a reduction in the interstitial and intermuscular edemas, and the appearance of reparative edema. And the last one, the remodeling phase, this phase can be a little bit tricky to assess due to overlapping findings, but in general, the scars matures. It first appears hypointense only on fluid-sensitive sequences, which we call phase 3A, and later becomes hypointense on both T1 and T2, named phase 3B, with minimal reparative edema present. Lastly, we wanted to define the final state of the scar, usually appearing with a very low signal and slightly thicker. We've noticed that we can almost always recognize where the injury occurred.
So, what do you predict will be the future role of the radiologist in predicting return to play?
Well, one of the key strengths of assessing healing through MRI is that it allows us not only to evaluate the stage of the scar, but also to identify signs that might suggest a risk of re-injury. In this context, radiologists play an important role due to our ability to discern subtle radiological signs that only a well-trained eye can detect. These signs are typically associated with acute muscle injuries and should not be present in an MRI in an advanced stages of healing. Some of these signs include transverse tears of connective tissue during the healing process, persistence of immature scar tissue, persistence of reappearance of intermuscular edema, progression or reappearance of feathery intramuscular edema, and the persistence of lost connective tissue tension. However, it's important to note that imaging alone is not enough. Predicting the return to play is a complex process that depends on multiple factors and the involvement of various professionals. In this multidisciplinary approach, the radiologist plays a fundamental role.
Finally, what teaching points would you like the readers to take away from this article?
Sure. The key teaching points to take away from this article are the firstly, MRI scans are instrumental in identifying and differentiating between the various phases of muscle healing. Although the process is continuous and findings carry overlap, MRI provides crucial insights into the healing phases. Secondly, based on our findings, we proposed a classification system that builds on the Jarvinian phases and adds a final healed stage. This framework can help in better understanding the progression of healing and in making more informed clinical decisions. Third, a truncated high-resolution MRI protocol can offer valuable information during follow-up, It enables the detection of signs that may prompt medical teams to adjust rehabilitation plans or delay return to play and hasten patient care. And the last one, while our findings are promising, ongoing research and multicentric studies are essential. They will help further correlate biological healing stages with MRI findings, improving our approach to injury assessment and recovery.
Thank you again for your time today, as well as to the listeners for tuning in and joining us today. I learned so much from the article as well as this podcast. I encourage everyone listening in to check out this article as well as the rest of the published articles in radiographics.
Thank you very much, Diane.